But first, but first, just a couple of notes on the fact that what social work can look like in animal care environments or human-animal relationship environments can look really, really different across the world, and there's a recognition of this. There's a recognition that in some parts of the world, folks have been able to take this and sort of run with it and pilot and try out new ideas. Also, keeping in mind that what social work looks like, if it even exists in different parts of the world, might vary. And not everyone will use the language of veterinary social work. I know in conversations that I've had with folks in more of the Wasaba side, we are hearing things that people are doing that would qualify as veterinary social work, but are not necessarily using that terminology. So I think that's also important for us to keep in mind as we move through our conversation today. Even if you are listening to this talk today and you're like, there's probably, it would be hard for me to be able to put this into practice, we are attempting to shape the conversation tonight in a way where hopefully it piques insight, curiosity, and ideas. And so hopefully some seeds are planted. So with that, let's get into it. I'd like to take a moment to introduce all that are joining us. So first, if you're able to maybe just sort of wave your hand when I introduce you, Augusta O'Reilly is a veterinary social worker from Southern Virginia in the United States and works with the Virginia Tech VA MD College of Veterinary Medicine Teaching Hospital, where she supports families experiencing caregiver burnout, pet-related grief, and mental health support to the hospital's professional team. Thank you for joining us, Augusta. We also have Rebecca, Rebecca Stevens, is an associate professor in social work and is the UK's first veterinary social worker. Rebecca's work focuses on building interdisciplinary partnerships across social work, vet med, and animal welfare to strengthen human support within animal care settings. Thank you, Rebecca, for joining us. We also have Sarah Bernardi. Hi, Sarah. Joining us from Toronto, Ontario, Canada. And Sarah is a veterinary social worker at the Ontario Veterinary College's Health Sciences Centre in Canada, where she supports pet caregivers and animal care staff across multiple hospital settings. She also leads a peer group to support mental health practitioners in veterinary hospitals and shelters. Thanks, Sarah. Wendy Till. Wendy is joining us from Perth, Western Australia, through her work with veterinary and community care. Her work brings a one welfare lens, focusing on access to veterinary care, interspecies families, and the interconnected well-being of people, animals, communities, and veterinary teams, particularly in the context of vulnerability and community support. So we can already see we've got a wealth of knowledge and experience. And we're also very pleased to have Dylan Dotson joining us tonight. And Dylan is the Director of Social Work at the Toronto Humane Society and Ontario's first social worker embedded within an animal welfare organization. Her work focuses on supporting marginalized communities through animal-assisted and community-based approaches. So thank you to each of you for joining us. I'd first like to turn it over to Augusta, recognizing that there's some folks who may be joining us tonight that are well-versed in vet social work, and others perhaps who might be hearing it for the first time. So Augusta, can you start by grounding the conversation for those who have never really heard of the field in particular on what veterinary social work is?
Yeah, absolutely. So to save some time and tongue twisters, I'm going to be using abbreviations. So VSW, or a veterinary social worker, it is a subset of social work that supports the human needs that arise at the intersection of the human-animal relationship. Sometimes we'll use relationship or bond interchangeably. It really is dependent on how the relationship looks. So we know that some people are going to be very bonded where they have their animals every day. Some are going to be a working relationship. And so we want to honor that. And so with that, we focus on the human's needs that arrive, whether it's the guardian of the animal, the professional that provides the care, or the community that is actively developing policies around a bonded family. And so a VSW, it was created taking the ethics and the teaching of social work, but a VSW is not a protected title, whereas a social work in many of the countries and um, it's the end of the day here for me. So, in provinces and things like that, a social work is a protected title. And so, with that, it's not a protected title, but the work that we do is inherently interdisciplinary. And so we have other mental health providers doing similar works. We have researchers, we have other professions that are aligned in the mission that we serve. So sometimes we use it as a blanket term as well. But traditionally, it is a social worker that is focusing on this. And there's often five main practices within this scope. And so, real briefly, the first one is grief and bereavement support. This includes pet loss, counseling, anticipatory grief, helping families and staff navigate difficult decisions in euthanasia. We also have compassion fatigue and wellness, which is where a lot of the ones, especially in Angie and I's work, this is where a lot of this context is coming out of. And so this looks like the wellness support for animal related professionals. It can look like burnout prevention, crisis support, debriefings, resiliency programs, all of which we're going to be hearing a little bit more about in detail. The third area is the link between human animal violence. Most of the time, we just call this the link. Research has shown a strong connection and correlation between animal abuse, interpersonal violence, child abuse, and elder abuse. And so a VSW can help with trauma-informed interventions, reporting pathways, safety plannings, and things like that. The fourth area is animal assisted interventions. And so this is where we are partnering with animals and using them thoughtfully through therapeutic interventions and models. So we see it education, community settings, things like that. And then the last one that was recently added in the past few years is looking at the environmental impact on the human animal relationship. So thinking of conservation, natural disasters, things like that, and how those events are shaping our relationship with animals and each other. And so within that, we look at something as small as the individuals, looking all the way up to systems level. So a VSW can do a lot of different things, and that's one of the reasons why it leans more towards social work. Social work is inherently a little bit of everything. So we can do individual work, we can do community work, and we can do systems work. And so with that, this field has really grown over the last decade, especially as research has come out that there are more homes reporting having animals in them than children. And so we're realizing that there's this push and need to support the human animal bond. And so that is where this field has really taken growth and expanding in veterinary schools, hospitals, organizations such as policies, legislation, and things like that.
There was a word that you said in there, Augusta, growing, right? I think growth is really the word, and ever expanding, and an understanding that our understanding of veterinary social work is shifting the more practice that we have on the front line. So thank you for a very comprehensive intro. So, with that, let's actually start to explore what veterinary social work has looked like on the front lines with our speakers tonight. So, Sarah, I'd love to start with you first. And the question that I'd love to ask is your work is based, as we mentioned, at the Ontario Veterinary College Health Sciences Center. What does veterinary social work look like in a teaching hospital setting? And where do you see the impact most clearly for clients, students, and veterinary teams?
All right. Well, I'm happy to answer this question and I'm super happy to be here. Hello, everyone. So I think maybe where I'll start is just by saying a teaching hospital in veterinary medicine is a really dynamic and complex environment. Because alongside of the specialty care that's being provided, you also have teaching, research, and training all happening at the same time, right? So within one space, we have faculty, clinicians, student learners who are all at different stages in their clinical practice and education, our clients, of course, and support staff who are all interacting with one another. So as you can imagine, that is a lot of different perspectives and responsibilities and even emotional needs that are moving through our system every single day. So at the Ontario Veterinary College, my service is the Veterinary Social Work Service, or to use our shortened form, our VSW service. It's integrated into the patient care teams. So that means that this service supports clients while they follow their animals on their care journey, whether that's inpatient or outpatient or even after death. That might look like facilitating communication between our vet teams and our clients, or sometimes between our vet teams and other team members as well, and even just assisting our hospital personnel in navigating some of these more emotionally complex situations. So in this kind of setting, I think that the impact of veterinary social work really becomes very visible in the human and relational side of care. We know that vet med is never just about treating just the animal, right? It's also about supporting the people that are connected to our animals, as well as the teams providing the care. They're included in that as well. So as you know, just to kind of go back to Augusta's explanation of vet social work for a moment, this is a profession that focuses on some of those human dimensions of veterinary medicine. So for me, in my setting, that means maybe paying attention to what people are bringing in to the hospital, right? Or the exam room, especially during stressful and emotionally charged situations. Sometimes we have people who are in this setting and carrying fear with them, uncertainty. Grief is a big one, financial stress, or even guilt. And there's many others I haven't mentioned, but all of those emotions, they really shape how we process information and make decisions, right? And I think probably one of the clearest examples of this that I can give in my work is just around end of life care. So in North America, humane euthanasia is a widely accepted and often medically appropriate option that's given towards end of life. But that does not make that experience necessarily easy to decide on or even black and white, right? An example is a client who is coming into the hospital and getting unexpected news about a beloved animal's condition and trying to maybe process shock and sadness and again, that uncertainty, while also being asked to maybe make a very difficult, again, unexpected end of life decision. That's not the only scenario, but just sort of as an example. And for many people, our companion animals are our family. So those moments feel incredibly overwhelming at times. And at the same time, we have to look at the other side of this, right? Our veterinarians and our veterinary teams are trying to guide those conversations clearly and compassionately while also carrying the emotional work the emotional weight of doing this work repeatedly. I also have to mention students because I'm in a teaching hospital too. Our students are here to learn, and for a lot of them, this is their first time participating in these type of conversations. So that's another layer of learning and emotional processing that's happening maybe simultaneously. So veterinary social work as a lens in this kind of hospital setting really helps us sort of take a step back and see the full picture. We're not just dealing with things like medical decisions or basic, treatment, right? These are deeply human experiences that are really shaped by things like attachment, responsibility, grief, culture, and values. And that might mean helping clients process the information they're getting or the decision making they have to do. It might be supporting teams with these challenging cases, and again, helping students sort of reflect emotionally on some of these new experiences for them. So I see the impact not only on the micro level and sort of the day-to-day support I'm providing, but also on a macro level, right? Like Augusta was saying, social work works at different levels. So we see it systemically as well. I believe that like embedding a social work lens in the culture of veterinary medicine means that we are more effectively caring for the human-animal bond. So yeah, that's kind of what that looks like in my setting and where its impact is.
That was a powerful last statement there to bring it together. So thanks for getting us started, Sarah. All right, Rebecca, we're going to come over to you now. So you've been involved in developing vet social work within practice and hospital settings. What does this look like in a context where the role is still emerging, and what needs is it helping to respond to?
Yeah, thank you so much. And thank you for asking me to be part of this panel discussion. So I think, what I've learned through my work and research establishing veterinary social work here in the UK is that the problems within the veterinary field are pretty much identical to those in the US, Canada, and Australia, where it does exist and is quite well established. And I came across veterinary social work, gosh, maybe 5 years ago. And honestly, it just clicked for me immediately. And I could really see the value of it straight away. And from that point, it became probably a bit of a life mission to make this a reality in the UK. But I also realized really quickly on that I couldn't just start knocking on veterinary practice doors saying, hey, I think you benefit from a social worker here. As much as I believed in it, I knew I needed evidence. I needed the research, I needed data, I needed the outcome, the facts, stats, and essentially I needed in this case that organisations could really.
Rebecca, just a heads up that I think we might have lost Rebecca for a moment. Let's just give it a moment. She may, the signal might toggle back on here for her. The joys of technology. Okay. Just for time's sake, I'm wondering if perhaps, Wendy, we could come to you, and then when Rebecca's back on, we can jump back. Oh, yeah. Okay, so I think what we'll do is Wendy will come over to you, and then Rebecca will come back to you in a moment. It looks like we were having some. Sorry, Rebecca, are you back on? Do you want to try? We lost you there for a bit. Sorry, you're muted. Uh-oh. Are you able to unmute, Rebecca? No. Okay. Just for time. Oh, there you are. You are here.
No, I
Okay.
don't know. It just flipped me out.
That's okay. That's okay. We lost the latter part of what you were sharing, if you're able to come back to that.
Yeah, so I think I was saying that, as much as I believed in it, I needed the evidence behind me to sort of, bring a business case across that people could actually connect with. So I spent a lot of time researching the sector. I fully immersed myself in it. I was in a position where I could really understand and listen to what was happening to vet teams, not just the clinical team, but the non-clinical team. We're talking about receptionists as well, because in my experiences of my research, I'm actually finding that the receptionists, they cop it, they get a really hard time as well. So what I found, honestly, was a lot of it was about giving the language, using the right language to things that vets already know are happening. But what I found is that nobody in veterinary profession over here has actually needed convincing that these challenges exist. They are living them every day. It's part of their lived experience. But what I found is missing is a more structured and compassionate way of responding to them. So momentum really began when I moved from just preaching about it to actually doing something tangible. So since December of last year, of doing ethnographic research in a number of vet practices all over the UK, across England and Wales and Scotland, Northern Ireland, and these practices where I've immersed myself as what
Is it just me? I think we've lost. Yeah. Okay. Okay. We're going to come back to
Close.
Rebecca's final bits on this in just a moment. Wendy, let's come over to you. So, Wendy, your work is with veterinary and community care, where you bring a one welfare lens. When we consider access to care alongside the well-being of people, animals, communities, and veterinary teams, what needs become more visible? And how does your work respond to that?
Yeah, again, thank you very much for having me. It's absolutely fantastic to have like everyone from different countries joining. So thank you very much. So yes, I'm from Western Australia in Australia, and we've been developing a One Welfare social work pilot through our social enterprise veterinary and community care, which we call VAC. So one of the most important shifts has been moving kind of from asking, why isn't this person caring for their animal, which is that whole kind of responsible ownership lens where often when people are under stress or teams are under stress, they're like, why isn't this person doing the right thing for their animal? And we're kind of switching, have a bit of a paradigm shift to, well, what's happening for this person or their family or in their community? What's happening in their life that's affecting both the animal and the human well-being, because as everyone said, we know that they're linked now. So it's kind of that shift, and I think Rebecca talked a bit about language. I think once you kind of ask a different question, it opens up a whole different kind of way of thinking about what might be going on for that interspecies family. So when we take a one welfare perspective, which is linking that lovely framework, which links people, humans, animals, non-human animals, and the environment or the systems that we all share, a whole range of previously kind of invisible needs become visible. So when I kind of do little talks to people about this for the first time for vet teams, I use that iceberg model. So this is what you might see at the top, an emotional reaction, and this is what might be happening underneath. So veterinary community care auspices Perth Street Vet Service, and we see people experiencing homelessness who are choosing to remain on the street rather than relinquish an animal. That animal might provide safety, connection, purpose. There may also be many barriers. A lot of human service, or most human service organisations in Western Australia do not allow animals. They're not animal inclusive. We've got a long way to go there. So you know, for these people, this animal might be their strongest, most significant relationship. So it's really, really important that we try and keep these bonds together. We see older people delaying veterinary care because they're socially isolated or they're frightened of losing their only companion. And they may be, you know, again, elder abuse, financial stress, all those kind of things might be at that bottom of that iceberg. We see family violence situations where threats to animals are being used as a force of coercive control, and this is a very hidden thing. It's not really disclosed, and that's part of the whole coercive control mechanism from perpetrators of violence. Again, social work is, you know, very much positioned to work within that space. We see financial hardship, which is huge over here with the cost of living at the moment, disability, mental ill health, grief, trauma, and housing instability. And these all influence animal welfare outcomes. So at the same time, you've kind of all talked about it, we see the veterinary professionals, they're carrying the emotional burden of these situations. They often know what an animal needs medically, but they're working within the realities of what the person can afford, access, manage, all the treatment plan stuff. And this gap can create significant moral distress for teams when they know what the animal might need, but for whatever reason, that level of care just can't be accessed by the person. So our response has been to develop this one welfare social work model that supports all parts of the system. So it's very holistic in its kind of response. We were very, very lucky a couple of years ago to get a WA government-funded pilot program getting up and going, and we're training 5 experienced social workers to work alongside veterinary teams and some community-based animal services. And the role focuses on supporting what we call contextualised care conversations, which I think in other parts of the world are kind of called those spectrum of care kind of models, which is identifying the barriers affecting treatment decisions for people and interspecies families, providing that grief and loss support and connecting people with community services, as well as supporting the veterinary team with their wellbeing and strengthening referral pathways between animal and human service sectors. So part of a big thing of what we're doing is trying to get those humans and animal sectors talking to each other and connecting them together. So our main goal is to strengthen the human animal support around veterinary and animal care so that better outcomes become possible for both people and their animals, as well as advocate for systems change from human services, because we do need that paradigm shift from a historically anthropocentric lens to validating the strength of the human-animal bond and creating these more animal-inclusive responses to challenges. I think we have to move forward that way. And what we've learned is that many animal welfare concerns are not simply animal problems. And vets have known this and teams have known this for a long time, but not really known what to do with that. So they're often human-animal system problems. And through a One Welfare lens, these require these interdisciplinary, multidisciplinary responses. I think that's about it.
Thank you so much, Wendy. As each of you were talking, I wish I could sit with you for hours to unpack this more, but it becomes so obvious, right? When we understand the purpose and the value of social work as seeing the interconnectedness between the individual experience, how we show up in community, and how the systems impact us, and just how much logical sense these frameworks then make. And I know, Sarah, you alluded to that as well a little bit before, so thank you. Dylan, I'd love to come over to you, and then Rebecca, we'll come back to you so you get to finish off the part that we didn't get to before. Dylan, thank you so much for joining us with your work at the Toronto Humane Society. Can you share with us what social work looks like within a humane society setting and sheltering models more broadly, and what needs you see the work responding to?
Absolutely. Thank you so much. It's an honor to be here with my esteemed colleagues and the group tonight. As you've heard, veterinary social work or social work in animal care spaces really focuses on the well-being of the humans who care for, advocate for, and make decisions about animals. And this is certainly the case in humane societies or shelters more generally. Within shelter models, this may include support for shelter staff, right, such as the vet med staff, volunteers. Oftentimes shelters are often run by a tremendous amount of volunteers. We may also provide support to community members, pet guardians, similar to what Wendy was referencing. Many shelters offer low-cost veterinary services or operate a dearth of community programs, and as such, community members may be navigating difficulties that arise at the intersection of pet guardianship. So these are certainly places that social workers can help navigate program development, program expansion, community engagement. Importantly, in shelter spaces, veterinary social work also recognizes that animal control or enforcement is often a part of sheltering in many parts of the world. And so supporting officers who work at the intersection of public safety, enforcement, and animal cruelty and neglect is really, really critical for shelter worlds. This role, obviously carries unique stressors and frequent exposure to tremendous trauma. The other population that's particularly unique to shelter models is the animal care staff. So our animal care staff often have lengthy relationships with animals, right? Animals often in the shelter, they are unowned animals. They do not have an owner. So by proxy, the shelter is the owner of these animals and are therefore making the decisions and the pathways for what will happen next for the animal. And our animal care staff are the ones who are having the most interactions with the animals. They're walking them, they're feeding them. In some cases, if there's resources, they're training them, they're working on sort of whatever it is that hopefully will lead towards an adoption outcome. And while many animals have live outcomes that proceed through adoptions, that is still a goodbye for some of the staff that have been working with the animals for a long period of time. And the other reality in shelter world is that sometimes animals do not have live outcomes in this world, right? And so, many come to us in dire straits, right? And so they are not able to have the new beginning that we hope most of our animals will have. And oftentimes these decisions are made after tremendous efforts are made, and so that bond is firmly in place. However, there are also difficult policies in shelters that can make it very difficult for the staff. If we have population management policies, maybe we have long relationships with animals, or maybe we have policies that indicate that, we can only house a certain number of animals. And if we're overpopulation, that number needs to be decreased. And this is an uncomfortable reality of global shelters, right? Um, so, social workers play a variety of roles, and it's really sort of based on what the community is requiring of us, right? Social workers help strengthen the human-animal bond by addressing social and structural factors that bring animals into shelter systems in the first place, right? Animals don't come to shelters on their own accord. Shelters come because of human-related difficulties. So very similar to what Wendy was talking about, poverty, housing insecurity, challenges in accessing veterinary care, community safety issues, environmental issues will often bring large populations of animals into shelters, right? And of course, systemic inequities. So in many shelters, this work shows up as crisis intervention, grief and bereavement, conflict mediation, community support programs, other types of initiatives that work with community. And so oftentimes shelters might be partnering with social service organizations or public health organizations. And these are roles that social workers are really good at, building community and building community within. I very much believe that animal shelters are a microcosm of what is happening in our community, in the wider community. And as much of the work is actually trying to help move the needle to view shelters as part of social safety nets. For the people both in the building and the animals, but really looking at that duo or that full family planning.
Thank you so much, Dylan. Given the complexity and the layers of the work happening, for any of you to be able to summarize this in 5 minutes, my hat's off. My hat goes off to each of you. So thank you, thank you. Rebecca, just for time's sake, I'm wondering if maybe in about a minute or so you could share with us final thoughts that we weren't able to hear earlier.
Oh, look, we're having a heat wave over here in the UK, and it has affected everything, the Wi-Fi and everything. So I think, so basically, I think in terms of creating this role, I have felt really conflicted about using the term veterinary social worker for probably the reasons that, and Wendy, I didn't hear your presentation, but I'm fully aware of, social work is a protected title. And social work is so misunderstood, particularly here in the UK. So I called this role veterinary human support worker. And I didn't want to limit it to just social work, because social work education and training here in the UK is different to other parts of the world. And so we opened it up. We had social workers apply, we had dog walkers apply, we had human palliative nurses apply as well. But actually, in the end, we recruited a paramedic, and her skill set and knowledge base aligned perfectly with that context. So I think the key message that I wanted to send is everything is context and practice specific. So through the research that I'm doing and my collaborations in the veterinary space, it's really about what is going to work for that environment. Now, it could be an embedded human services professional or social worker, or actually it could be someone, if you're talking about a corporate, where I'm doing some of my research, is they're regional. So where I live, there might be 40 or 50 first opinion or emergency hospitals, but it's not realistic to have a social worker embedded in each one. But it might be more realistic to have a veterinary social work, human support professional consulting with a number of practices across that, more so as in needed basis, or a consultancy and advisory role. So I think it's really important to do the research first and to find out what is most appropriate for that setting, for that practice, whether it's a corporate, an independent, a first opinion, or whatever it is, and where the priorities are. Is the priority focusing on the reception team? Is the priority focus on non-clinical? And what is the priority with vets? and all of this is context specific, and that's going to change across geographical boundaries.
And in a way, though, isn't that the beauty of so much of this, that it can be contextualized also to geographic area, the current
Yeah.
socio-political conditions, etc. Beautiful.
Yeah,
Thank you so
absolutely.
much.
Yep.
Yeah.
And just one final point, the job description that we created for this role isn't necessarily set in stone, because it's going to be shaped depending on the emerging needs that arise for the vet team over a period of time, because it's going to take time, isn't it, for the vet team to feel fully comfortable with having a human services professional in their space.
Absolutely. And I realize, there are many social workers working in this space who are not present here today, doing incredible work across the world. And through conversations, myself included, we often realize that we've come to create the positions based on community need, readiness, and resources. While there might be a slight shift to having jobs to apply to, I think the bulk of folks are figuring out how to create in response to needs. And your last bit there really highlights that. Thank you. Okay. So thanks to each of you for getting us into the depths of what this can look like in practice. The next area that we wanted to explore with both Sarah and Augusta is how veterinary social work can improve the professional well-being of those working in environments like hospitals, shelters, potentially other areas like wildlife conservation organizations, zoos, etc. So Sarah, let's get started with you.
Yeah, so I think this is a really good question. And, veterinary social work really contributes to professional well-being, not to oversimplify, but I really think by helping to recognize and also acknowledge just how emotionally demanding veterinary and animal care work really is. And I actually think all of our speakers today have highlighted that a little bit already, like some of the layers to this work. But again, the people coming into these roles are not just supporting animals. We communicate through the human being, so they're also supporting the human beings through stress and grief and uncertainty and so on. But I think like a really big part of how vet social work can show up in this space is by creating space for those experiences to be acknowledged instead of just maybe pushed aside. And again, that can look like supporting teams after difficult cases. Like, so if I'm talking sort of about the day-to-day stuff, I'll let maybe Augusta talk more about the systems, but, debriefing or helping, with the emotional labor of some of the communication, again, during more charged emotional situations, or even just giving staff and personnel a place to process what they are carrying, right? I also think it really helps to normalize conversations around mental health and emotional well-being within these settings. I think it's probably not a surprise to any of us. In a lot of caring professions, formal caregivers, people are really good at looking after others, but not always so great at recognizing when they themselves might need a little support. So if I go back to that idea of having vet social work is an important part of the culture of these spaces, we can help build a culture where checking in with each other and talking about these difficult realities of this work maybe becomes a little more acceptable. And I guess like to add to that too, I think another area where I see a real impact is just around communication. Again, we look at the balancing that these roles are doing. They're balancing patient cares and client stuff, but a lot of times vet professionals, and I'm just speaking towards like the veterinary industry for a moment, but they run their clinics, they do the finances, they carry so much. So being able to, again, recognize that and support in the communication that comes with those many roles can be, I think, really important for, again, bolstering communication, but also helping with things like conflict and reducing some of the emotional burden that helps teams feel a little more connected and supported with each other. For students and newer professionals, I think it's especially important to talk about professional well-being because it prepares them for this reality maybe early on before they enter their careers or just as they're entering their careers. It's not just about the medicine, it's having tools for coping, communicating, and building healthy professional relationships from the beginning are really key and really important. And they're not soft skills, they are hard skills that we need alongside the medicine. So when we have veterinary teams that feel more supported emotionally, it really just benefits everyone, right? The professionals, the clients, and then, of course, that filters to the care that's being provided for our animals. So I'll let Augusta take the next half of that.
Yeah, so definitely building off of that is, I think, acknowledging to the question in the chat about the difference of what a social worker is compared to a counselor or a therapist. I think a social worker or a VSW has that skill set to help develop programs, to help make changes at a higher level. All of us on here are social workers and we are developing programs. We're at a community level, we're at individual levels. And so that's something that really sets apart what this profession can do is really um, ebb and flow in between all of the different systems, all the different needs. And so I think a lot of us are often stewards for implementing changes and making sure those changes are carried out too. I've worked alongside a number of different professionals that care about communication, that have the skill set to teach the communication, that want to make changes for well-being, but they're also carrying their full-time jobs. And so my full-time job is to help keep those things afloat, make sure that they don't get swept under the rugs by management or different people coming in and out. And so I think that's what really helps having a social worker, whether they identify as a VSW or just a regular social worker, because VSWs are social workers. Social workers are able to do that because of our training and our background, that we can do individuals, but we can do systems. And that is really what I think helps make things sustainable when we're addressing both parts.
Yeah, there's really a beautiful theme that's weaving through here on all the way from the micro to that macro support. And Sarah, I know you mentioned this a couple of times, just how, regardless of what setting we're talking about, the integration of a social worker really is pivotal to those cultural shifts within organizations. Amazing. Thank you. So we're going to move now into another theme. I realize we have about 15 minutes left, but this one's going to offer us just some insights into perhaps global and regional landscape considerations. So I'll just name the question and then we can move through those of you that will be answering it. So due to regional differences, many animal care settings around the world will not have access to social workers or formal VSW roles. What parts of the human support lens feel most important and adaptable across different systems, professions, or regions? And please feel free to take this where it feels best for you. Dylan, can we start with you? And then we'll move into Rebecca and Wendy.
Sure, yeah. Globally, shelter systems are incredibly diverse, shaped by local culture, resources, legislation, and how animals are valued within society. So, while not every setting is going to have access to social work, I think the most adaptable elements of social work are really mindset and practice rather than role and title. So, as social workers, what we look at is trying to help people solve problems and looking at the problem being the problem, not the person being the problem, right? So, trying to ally with whoever it is that's in front of us, that human that's in front of us. If it is our colleague, if it is our pet owner, our guardian, if it is our transfer partner, whoever that is, and really sort of just like taking a zoom back and recognizing that we all have the same shared goal, which is really the well-being of the animal that's in question, right? I think another key part is advocacy, as well as knowledge of resources and systems. So, communities face different stressors, levels of resourcing, and expectations of animal care. And this human support lens, I think, asks not why isn't this better, but perhaps what pressures are people carrying here, and how can we partner with them in this context. So, in the era of brevity, I think that's what I would offer just in terms of transferableness.
I just want to reflect back one part that you said there. I had to write it down because I didn't want to lose it. when you said it's about mindset in practice, not role in title. That was very powerful because it really helps to see what still needs to happen regardless of the role that we are playing. So thank you for that insight, Dylan. Okay, Rebecca.
Yeah, thank you. So I think for me, the most transferable part of this work isn't necessarily the job title, it's the perspective, it's the lens from which we work and think about this role. And actually, it might simply be about recognizing that these conversations matter. And I think the risk sometimes is that we assume that you either have to have a veterinary social worker or a human support worker involved or not. Whereas actually, there are lots of small, meaningful ways that this human support perspective can be built into practice. And what I've learned so far in my research and practice is actually you don't always need a fully developed system to start that. Sometimes it starts with really small shifts in culture and a mindset and how teams talk to each other, you know, around difficult cases. And it's not just the in the moment debriefing about what happened. You know, we're not going to point fingers or it's not this blame culture, but to integrate more of a reflective professional discussion of what is the impact that this scenario, this situation had on you as a professional, and what this impacted you as a person. And I think that's really important because in the veterinary space, you know, these reflective conversations aren't really so much of a priority, or at least, you know, it's very nuanced as well. Whereas in social work, it's kind of our bread and butter. And so I think what's also really important is that we also prepare social workers. We prepare human services professionals. And it's just little things like embedding aspects related to the human animal bond in the social work curriculum. And what I've heard a lot over here is you're just adding to our workload or you're adding to an already packed curriculum. But it's not the case because there are already existing modules around safeguarding, around human development in the social world, you know, around human loss, grief and bereavement. And you can embed it within there. You can embed it within the existing structures. So it's not an add-on. So I think that's really important to notice these pockets of where you can drip feed it.
So powerful,
it's about
right?
making
Yeah,
it visible. Yeah.
that's it. And looking for the moments where these things are possible. Amazing.
And also building an evidence base. And again, you know, I never thought I would go into academia or research, but it's actually really important to have some facts and stats and evidence behind you to present a business case for its value and worth to the powers that be and the decision makers.
Yeah, beautiful. And I'm trying to keep an eye on the chat, and it already looks like there are folks who are trying to sort of play with ideas and move through. And as we can see from the expertise that is here, there are so many wonderful folks that people can reach out to. I'm volunteering all of you and myself that if you are curious about, hey, what can I start to adapt within our existing model? I know that we've got such a wealth of readiness within our community of folks that would be ready to share. So, Wendy, we're going to come to you, and just a heads up to the panel speakers. I think after this, if you're okay with it, we're going to move into the Q&A. Perfect.
Yep,
Thanks, Wendy.
sure. So, no worries. So one of the things we've been really conscious of in Australia is that many communities will never have access to social workers here. Definitely ones that have specialised skills and knowledge within kind of human-animal bond knowledge. WA on its own is a huge state. And really, it's very the services are really centred around the major cities and regional areas. And so we have Aboriginal communities who may only have a worker come in once a week, you know, a health worker, or so, you know, we kind of do have that diversity in our state. So because of that, we focus not on just building roles, a bit like uh, Rebecca's just said, but also on ways of thinking. And for me, the most transferable aspect of what we're doing is curiosity. So instead of immediately focusing on the presenting animal welfare concern, we can ask broader questions about the context in which that concern exists. So for veterinary teams who sometimes ask, why is this person being difficult? We suggest, well, what might be happening here? That what barriers are affecting care? What pressures might this family or community be experiencing? And what strengths or supports are already available? Because there are things around already present in people's lives. So by encouraging practitioners in human services to ask about animals in people's lives and really validating the importance of that attachment, we can make more informed and supported decisions for interspecies families and the communities that they're living in. And again, that culture comes in as well, as you've all talked about. So, and a second transferable principle, I think, is recognising that human wellbeing and animal wellbeing are interconnected. They're not two things. So when we're talking about social work education, Rebecca, totally agree with you. They're interconnected. We should be teaching them together. So you don't need a social worker to recognise grief, social isolation, family violence, poverty, housing instability, or trauma. And you don't need a social worker to understand that these factors influence animal outcomes. So what people really do need is practical referral pathways, trusted community partnerships, and the permission to have compassionate conversations. So social workers can provide these skills remotely, or they can support teams by sharing resources, so they can recommend referral and access pathways for those, kind of remote or areas that don't have these face-to-face services. And a very final important factor is recognising that the people doing this work also need the support, as everyone said. So whether you're a mobile veterinarian, up north, they practice across long distances, or you could be a volunteer working with an animal refuge charity, really at that pointy end of animal welfare. You could be a ranger or an animal welfare officer, really at the front line of animal abuse. That exposure to suffering really accumulates. So creating opportunities for reflection, peer support, debriefing, and psychologically safer workplaces may be one of the most important welfare interventions available, and that can be globally. It doesn't have to be a social work city-centric service. So while the specific roles may differ, the underlying principles of contextualised understanding, compassion, curiosity, and interdisciplinary collaboration are relevant, I think, everywhere.
Beautiful. And thank you, Dylan, Rebecca, and Wendy for showing us just those practical bits that I think really what we're talking about here is how do we take these principles and embed them regardless in any setting to build the capacity of those that are providing this care. So, Augusta, I'm going to turn it over to you for a moment. I haven't been able to keep my eye on the chat as well as you are. We probably have time for one or maybe two questions. Could you get us started with maybe one question here?
Yeah, I think been trying to keep them up because I know we have so many good things, and I was just typing out a long paragraph of like where to get more information. But one question that Madison came up with that I think is one that I hear a lot as the president of the association, essentially what advice would you give about creating opportunities in this field? Especially interested in tips for identifying community needs and developed advocate for your position or business, because I know that's something we have all done and are all doing. So before I dive in, I will we'll pass it over to Sarah first, and then you're next on my screen. So
Sure. I'm just reading the question while I'm processing it.
I can also, because I've been mulling over it, so I can.
Yeah, do you mind doing first so I can just
What you guys are thinking?
I need to do both.
Yeah. So one of the things you can tell we work a lot together. One of the things that I have done because I've had the privilege of working with different organizations. Social workers love a need assessment. So essentially going in and getting kind of a scope or a pulse on what are the needs of your organization or the individual. It can be tailored specifically to them so that you're really understanding what their needs are. This is a great place to really start, and it also helps develop job descriptions, what your expectations are going to be, especially if you're coming in new. We really try to advocate for know what your limitations are, know where your skills are, and know to what the expectations are, because this is such a new field. And like Rebecca said, things are changing every week. I've been in my role for 3 years, this place, and every year it's something different. And so I think really having that understanding of, okay, what are the expectations, the basic expectations coming in, and having that needs assessment really gives you a, okay, what am I getting into, essentially.
Sorry, I know we don't have much time left. I guess I answered that so beautifully. I don't want to add too much to it. Well done. And I think, the only thing I want to add is that sometimes something that happens is you get out into the field and, you're working hard to try and like create a path to yourself. And sometimes it can be really tricky. If you end up in a social work role that isn't necessarily vet social work, you can still bring in the elements of veterinary social work into that role. It's been said many times. I've watched, Dylan had said this in a presentation way back when, and I want to come back to it for a second. Even if you're working in a community agency and you have an intake and you see that there's not a question about other animals in the household, that is doing something. That is doing something that's within the scope of that social work to me. Like that's important. You can bring animals into the mainstream of what we do. So I just wanted to tack that on the end there, but very well said.
Can I quickly make a point? This might be off. I think that the message that is really important to make here, particularly in the social work world, is that you don't have to be an animal person. You don't even have to like animals, but it shouldn't stop you from asking about them. So in the UK, and it's very similar to other countries, but over here, 98% of pet caregivers, pet guardians consider their animals family. So I think that statistic speaks for itself.
Thank you. I see, Augusta, you were able to kind of start to address some of the other questions in the chat, so thank you. Out of the interest of time, perhaps as a closing here, just letting folks know that I'm going to imagine many of you do know this and some perhaps do not. But if you are interested in delving deeper into understanding veterinary social work, I would encourage you to check out the International Association of Veterinary Social Work, where you're going to find lots more information, and that might be a next place for folks to continue to go. So, to each of our panel speakers today, thank you for joining us today, joining us with your expertise, your insights, and from what I am picking up on in the chat, the inspiration that you are each providing to those that are listening and to those that will continue to listen in the recording in the days and the weeks to come. So, a big, big thank you. And to all of you that joined us today, we know life is busy, so we appreciate you taking the time to be with us. Enjoy the rest of your day, your night, your morning, wherever you are calling in from.